Hello, I'm Lenore Ackerman, and I am an assistant professor of urology here at UCLA in our Center for Women's Pelvic Health. And as a urogynecologist, I see a lot of women with complaints about a loss of control over when and where they can urinate. And so I've titled this talk "To Pee or Not to Pee," just to have a little bit more of a conversation about overactive bladder. So overactive bladder is really characterized by this sudden urgency or this sudden urge to run to the bathroom. And often that urge is associated with a fear that you're just not going to make it there in time. Now, everybody may not leak. There may be people who can totally get there in time, but that fear of not being able to make it is something that can really impact your quality of life and disrupt a lot of your daily activities. Now, overactive bladder is often associated as well with a need to urinate frequently. And this often just means that it's more than you're used to, or it's so much that it's disrupting your activities. And also, it can be associated with nighttime urination. And when that nighttime urination starts to interfere with your quality of sleep and then manifest itself with daytime fatigue or sleepiness as well, these are all the ways in which it can be a problem for you. So to take a second, we're going to take a step backwards, and we're going to first talk a little bit about what the normal function of the bladder is so that we can understand what goes wrong in overactive bladder. So the bladder really only has two functions. The first of which is storage. That's holding on to the urine while you're trying to wait for the appropriate time to go. And the other is emptying. And so in order for you to store urine appropriately, the bladder has to fill up kind of like a balloon while the urethra or the sphincter muscle squeezes tightly to hold everything inside. And then when you go to the bathroom, the opposite has to happen, where the bladder then contracts and pushes the urine out while the urinary sphincter opens and allows that to flow. Now, for the bladder to function normally and to function at the socially appropriate time for you to go, it has to be coordinated by your brain. And so all of this is coordinated by your brain and your conscious mind telling you when is the right time to go. So the bladder fills, and all this time your brain is telling it not the right time to go, not the right time to go. And then when it suddenly is the right time and you decide you can go to the bathroom, that's when your brain tells the whole system, now it's time to do the opposite. The bladder squeezes and contracts to push out the urine, the urethra opens and relaxes, and the urine flows nicely. An overactive bladder is basically when some part of that whole process goes wrong. And so when we're babies, we actually void reflexively. Basically what that means is that as the bladder fills, it sends a signal to the spinal cord that tells the bladder it's full, and then without waiting for any influence from the brain, there's a signal that comes back from the spinal cord to tell the bladder that it's okay to empty. But as we get older and we get to be potty trained, what is really happening there is that this reflex, this little circular communication between the spinal cord and the bladder, gets influenced by our higher centers of cognition, or our brain. And the problem when we have overactive bladder is when that communication gets out of whack. And so the bladder decides, I feel full and I'm sending those signals to go, even though I'm not really full. Or it can be that the brain just isn't quite sure what the bladder is saying, and so it doesn't really control the bladder appropriately. It can be that the bladder just decides, I'm not going to listen, I'm just going to go when I feel like it. Or it can be that there's something else irritating the bladder and causing the bladder to empty or contract even when it's not the appropriate time. And so that sense, or that bladder contraction, we often refer to this as a bladder spasm, where the bladder muscle itself contracts, pushing that urine out even when you did not tell it was the right time to go. And so that bladder spasm is when those muscles start to contract on their own, even when the volume of the bladder is not so big that it really needs to go, and even when your brain is telling it that it's not the right time. And this creates what we sense when we feel that is that urgent need to go. That's what urgency is. It's when that bladder starts to spasm and we sense it as, oh, I really got to run to the bathroom right now or I'm going to be in trouble. And that sensation is something we call urgency. And so let's take a second and talk a little bit about the terminology, because this is not always necessarily an intuitive kind of set of words to use to describe these sensations. So we talked a lot so far about this idea of urgency. That's that sudden, compelling need to run to the bathroom to urinate. That may or may not be associated with incontinence, which is leakage of urine or an involuntary loss of urine. You don't want to go, but it's coming out anyway. And again, often comes with that frequency. You go to the bathroom a lot more than you think you should. And that can sometimes just be because you're trying to make sure your bladder is always empty so that you never end up with that urgency. And sometimes it can be because you're getting those signals to go more frequently than you should. And often, again, associated with getting up at nighttime to pee as well. And all of those things together are the common symptoms of overactive bladder. Now, there are a lot of other symptoms people may complain of, and I've given you sort of partially list here. But the thing to know about some of these other things, like hesitancy when it's hard to get the urine started, or dysuria, which is pain with urination, or straining, really having to push to get the urine out. A lot of these symptoms, these can often be signs that there's something else other than overactive bladder going on, and this may indicate that before you get started with any particular treatment, it may be time to talk to your doctor. Now, we talked also a little bit about incontinence, this involuntary loss of urine. And it turns out there are actually a lot of different types of incontinence. Now, the hallmark of overactive bladder is really this urgency incontinence. And that's when you lose urine related to that sense of urgency. So you get that feeling, feel like you have to run to the bathroom, and you just can't quite make it there in time. Urine starts coming out before you can get to the bathroom and sit down on the toilet. There are other types of incontinence as well, and it's actually very frequently that people have more than one type. So it is not uncommon, for example, for people to have what's called stress incontinence. That's where you lose urine associated with some physical activities like coughing, sneezing, or physical exercise. And often these two things can go together. That's what we call mixed incontinence, when you have both that urgency-related continence and the stress-related incontinence. But these two types, even in combination, are different from some other types, which are continuous incontinence, where you lose urine all the time, don't know what's happening, but it's just happening all the time. And this, again, is one of those things that's not the same and different from overactive bladder, and probably means you need to go talk with your physician. As well as insensate incontinence, and that's a big word to basically just mean you don't feel it happening. It may happen on and off, but it's not associated with that sense of urgency. And so again, when we're talking about overactive bladder, we're really focused on this idea of losing urine with that sudden urge to go in a way that you can't control before you get to the bathroom. All right, so again, we've stressed this a bunch of times now. Urgency is our classic feature of overactive bladder. But I want to take this second to come back a second and say, it isn't just that you have these symptoms. It's really focused on whether you find them to be a problem in your life. Frankly, it's not a dangerous set of symptoms, but if it's interfering with your life, with your activities, if it's keeping you from doing the things that you want to be doing, that's when it's a problem. And only you know that. You're the only person that can decide that. And so a lot of people, when they start to feel these symptoms, they're more worried about, is this something really serious? Could this be a sign of cancer or something really, really bad that's gonna be life-threatening? Well, the good news is they can be very distressing symptoms, but it's not a life-threatening condition. And so a lot of people have it. It is something that's very common, affects billions of people across the world, in every country, in every walk of life. But although it is very common, it should not be considered normal. And while it does increase in incidence with age, again, it shouldn't be considered part of the normal aging process. If it is bothering you, then it's not normal and it's not okay. And there are things that we can do to make it better. And so I want to come back to this idea of what bothers you. And only you can know that, and it's often worthwhile to know that these kind of symptoms can affect people in a lot of different ways. And that it's really okay to know that this is something that's affecting you and something that you want to work on to make your life better. You don't just have to cope with it. And so some things that people complain of are that there's a lot of psychological pressure. It's this fear that sits with them all the time. It's very hard to get over, and that really impacts what they do with their time in their life. And that means sometimes people will avoid social activities. They'll stay home rather than going out with their friends or trying a new activity. And that often leaves people feeling really isolated. Sometimes people are losing sleep because they're being woken up at night by all these symptoms. And that leads to just not being able to function the same way during the day that they want to, and also can lead to other health problems. And then these symptoms can stress relationships, both personal relationships with your partner or as well as other friends or other family members. And especially when that begins to impact intimacy or closeness with not just partners, but also with friends, that really can take a huge emotional toll. And so all of that can lead to stress, depression, anxiety, embarrassment, and low self-esteem. And it's okay to admit that those things are impacting you, and that's why we're here, because there are things that we can do. And so if you're having any of these things, it really is time to talk to your doctor about what you can do to make these symptoms better. And so, if you were going to go in to talk with your physician, let's talk a little bit about what to expect when you see them. So probably most physicians, when they ask more about these symptoms, are going to get kind of a general picture of your medical history, the things that are going on in your life, what symptoms you have, how long they've been going on and how they affect you. And then they're probably going to do a physical exam as well, maybe look for other causes of these symptoms or things that might be influencing them. Now, sometimes they may ask for additional tests or additional just information, and we'll talk a little bit about what each of these things might be. And very rarely, they might ask for some imaging or other diagnostic testing. Now, we'll talk again about these in a second, but most of the time, this is what everyone is going to get, and you may not get anything more than that because we can start working on treatment without doing a lot of other invasive or difficult testing. So let's talk about those individual things. So in terms of the medical history, they're going to ask you a lot about those urinary symptoms. How often do you need to go? Are there any specific situations in which you leak? How urgent is it? How much time do you have to get to the bathroom before you may leak? When is it happening? Is it only certain times of the day? Only after certain triggers or events? Do you get up at night to go? Do you have any difficulty emptying your bladder? These are the kinds of things they may ask. And then ask some things about your life and your lifestyle, including what kind of things you drink throughout the course of the day, what kinds of things that maybe, these are what we call bladder irritants, any prior surgeries, especially in the pelvis or in the area of the bladder, other medications that you may take, other types of medical conditions you may have, and most importantly, how this is impacting your life and what your goals are to make it better. So, some people, and I just want to mention this, it's not the topic for today, but some people also have control issues with their bowels. This can mean things like fecal incontinence, a loss of either gas or a little bit of stool or a full loss of stool, also often associated with a sensation of urgency. And just as a side note, that does tend to change some of the treatment options we may have. And so definitely do bring that up with your doctor. It can be embarrassing, it can be distressing, but if they know more about what's bothering you, they can do a better job of helping you. All right, so let's talk a little bit about the physical exam. Now, not every physical exam will necessarily include a pelvic exam or a general exam, but I would expect but if you're going in to see your doctor, expect that may be part of the evaluation. And what that allows us to do is try to determine, is there any other thing that could be influencing what is going on and why you have these symptoms? For example, there's a condition called pelvic organ prolapse. When the organs inside the body fall down, they're not as well supported as they used to be, and that can give people a lot of urinary symptoms. And there may be a different set of treatments available for someone with that condition, and it may be more complicated than just straightforward overactive bladder. And so that's what somebody is looking for in doing a physical exam. So anticipate for women a pelvic exam, or for men a genital and rectal exam. Then there may be the need to start thinking about, are there modifications or certain triggers in your life that are bringing on these symptoms? And one of the best ways of getting a better picture of how your urinary symptoms are affecting your life is what's called a bladder diary. And a bladder diary basically just chronicles how much you drink, when you drink it, how much you pee, and when you pee. And then again, when, as well as when or if you leak. And so this is sort of a sample diary here, where you follow over time when things are happening. So when you had a soda, and then afterwards when you urinated, and so on and so forth throughout the day. And this really, really helps your physician sort out, are there particular things that we can change or modify that may help you be in better control of your urine? And then another test that may be done, not necessarily for everybody, is what's called a post-void residual. This is basically, we're just taking a look at how much is left in your bladder after you go to the bathroom. And this is really done just to make sure that you can empty your bladder completely. Because again, if you can't empty your bladder completely, that may change how we approach your symptoms. And then lastly, sometimes your physician may get a urinalysis. That's basically where we take a small sample of urine and we look at it under the microscope to see if there's any abnormal cells or stones or anything unusual in there that, again, might change what we do for treatment. And it's usually not necessary to get a urine culture. Most of the time, if your symptoms have been pretty stable and pretty chronic, it's not necessary to check for infections, but if something is suspicious, there may be a urine culture done as well. All right, sometimes if some of those early tests do suggest, or some of your symptoms suggest that there could be something more complicated, like you aren't emptying your bladder very well, or there are some things that they found on physical exam that might complicate treatments, they may send you for further testing. And these are things like some imaging, looking at your bladder by ultrasound or by CT scan, or checking to see if you empty your bladder all the way with some functional testing called urodynamics. Now, these probably will not occur at that first visit and likely would occur only after a discussion with your physician as to why they were necessary. But just know that most of the time, more advanced testing is not necessary to get started with treatment. And then lastly, I really just want to stress a couple of the things that we've talked about already. One is that overactive bladder is not a normal part of getting older. And while it may be common, don't think that there's nothing you can do about it. It's not just part of being a woman. It's not just part of having a big prostate. And it's not caused by anything that you did or anything that you could change. And lastly, surgery, not the only treatment. While there are some surgeries that sometimes can help, most of the time we're going to start off with some pretty simple interventions that may make a big difference. And those treatments, there's a ton of them that can really help. And so don't be afraid to bring this up with your provider. There are some things to know about, which are some other conditions, some other types of medical conditions that can influence how your bladder works. And some of these may make you a little bit more prone to having overactive bladder-like symptoms. One of those is neurologic diseases, and those are things like multiple sclerosis or history of a prior stroke, or things like diabetes, which definitely can irritate your bladder and lead to a lot more of that overactive sensations. There can be things that happen due to injuries or prior pregnancies, like muscle weakness, and definitely the hormonal changes, particularly those associated with menopause, can predispose you to having overactive bladder. There are many medications that influence bladder function that can both irritate the bladder and make you make more urine, which can cause similar symptoms to overactive bladder. And as we've talked about before, there are things that can get in the way of you being able to empty your bladder well, things like prolapse or a big prostate. And these are things that we probably want to consider addressing in concert with those overactive bladder symptoms. Lastly, there's a common co-occurrence of issues with bowel movements that comes along with overactive bladder. As I mentioned before, it's not uncommon that people who have urgency to urinate will also have issues with either constipation or with fecal urgency or fecal incontinence. And definitely everything gets a whole lot more complicated if you've had prior surgery in that area, and that can sometimes itself be a cause of some of these symptoms. But frankly, most of the time, overactive bladder just happens, and there's nothing you did, and there's nothing you could have changed, and there's nothing you could do differently in the future. It's just going to be something that we have to manage and deal with moving forward. And so the hope is that this is somewhat reassuring, that it's not a scary thing. It is a common thing, but that doesn't mean you have to just accept that it's the way you have to live and that we have things that we can do. Other things to know about, and these are hopefully things that will come out during that discussion with your physician or during that bladder diary that we mentioned, are things that can influence how much urine your body makes or how often you need to pee. One of those can be medications. It's not uncommon. People take things like diuretics that make you make more urine, or things that irritate the bladder like caffeine and alcohol. There are also people who may actually be able to get to the bathroom just fine. They have plenty of time, but due to mobility issues, meaning if you're wheelchair bound or if you need a walker and it takes you a while to get there, maybe that just makes it just a little bit too much time needed to get to the bathroom, and you can have accidents along the way. In addition, there is an association of declining cognitive function. So if you are starting to have some early signs of memory issues or other cognitive issues, it's not uncommon that bladder symptoms come along with that. And so again, while all of these things may influence your symptoms, they often are not the only reason, and they're not a reason to worry that these are the causes of why you have those symptoms. Just know that sometimes these can play together to make things a little more challenging. And so, is it just me? Are you the only person with these symptoms? I hear a lot of patients tell me that they feel really alone, like they're the only person they know who has anything like this. And that's not the case. I promise you, if you look around a room at a couple other people, at least a couple of them are experiencing exactly what you're experiencing. They're just not talking about it either. So the estimated prevalence of overactive bladder, that means how many people in the world are thought to have this, can be as high as 40% of women. And that is for all ages, all comers across the world. As we get older, the incidence of those symptoms gets even higher, reaching as much as 75% of older individuals over, say, 75. And so you're not alone. It's a lot of the embarrassment that keeps us from talking about this, but just know it's really common and it's not just you. And again, although it's common, particularly as we get older, don't let that be convincing you that it's a normal part of life or of aging. Get some help, get your life back, get your functionality back. The sad part of that, I wish it weren't true, is that overactive bladder is a chronic condition. We don't currently have any kind of cure for this, but there is still a lot that we can do to make it better. So let's talk a little bit about that. What can you do? And here I want to talk about some things. You can talk with your physician about some of these options as well, but if you're listening to this and you're saying to yourself, how can I get started? Here's some easy ways to get started. So we mentioned a minute ago about this idea of bladder irritants. These are things that piss the bladder off. These are things that really irritate it and make it need to go even more urgently, and make you more likely to leak. And some really common ones you can see here are things like caffeine and alcohol, and there are some irritants like chocolate. Most of this is actually just from the caffeine in the chocolate. Really acidic foods like citrus or tomato sauce, and things like sodas, which are also very acidic. And so one of the things you can do is limit those things. Have less of them and see if that makes a difference in your symptoms. If cutting back from 3 cups of coffee to 1 makes a big difference in being able to hold it during the day, that's a great start. Some other things that we can do are modifying the ways in which we go to the bathroom. And so one of those can actually be something that we call bladder training. Now, bladder training is not, think of it like a physical fitness program for your bladder a little bit. What we ask people to do is when they first get that urge to go to the bathroom is try to wait just a little bit, maybe only a couple minutes, and try to sort of tell your bladder no, and give yourself just a little bit more time. And as the weeks go by, try to increase that amount of time that you wait, 5 minutes to 10 minutes, 10 minutes to 15 minutes. And as your bladder gets used to holding a slightly larger volume, those irritating signals going back to your spinal cord and to your brain will lessen. They'll happen later. Your bladder capacity will increase, and you can hopefully hold it a little bit longer and with a little bit more confidence. The other thing you can do is follow a schedule. Just make sure that you're never sitting in that situation where it's been 3 hours and, now that you're starting to think about, have I been to the bathroom in a while? It's already too late. And so often doing what we call timed voiding, or going to the bathroom on a schedule, making sure you never get past about 2 hours, can prevent you from ever being in that situation where you start to get that sudden urge and you have to run to the bathroom and you're afraid you may not make it. And lastly, there's something called double voiding. And basically that's when you go to the bathroom, you sit down, you go till you'll think you're done. Then maybe you take a second, take a couple deep breaths, and try just one more time just to make sure you're completely empty before you get off the toilet. Now that doesn't mean you stand there for 20 minutes. That's probably not good for you either. It just means take a second, take a deep breath, try one more time, and when you feel fully empty, you can get up and get back about your day. So the next thing can be some pelvic floor muscle exercises. This can strengthen that muscle that holds in the urine, give you a little bit better control. How do I do that? Well, everybody hears this, go do some Kegels. Well, let's talk about what a Kegel really is. A Kegel is basically trying to take those pelvic floor muscles that squeeze the urethra, that hold up all those pelvic organs, and try to contract them. And I'll give you a piece of advice. The best way to think about this is that as you're peeing, try to stop the stream by contracting your muscles. And if you can do that, that's the right set of muscles to be contracting. And when you do it, you want to hold those muscles for about 5 seconds, and then make sure you take the time to release them for another 5 seconds. And do about 10 of these at a time, about 10 times over the course of the day. So I used to tell people before streaming services that to just do them during commercial breaks or when you're stopped at a red light. It's a great way to sort of like pass that little bit of time that you aren't not doing much otherwise. Now that we have streaming services, you may have to just wait and do it between shows. But either way, take a couple times throughout the day to just make sure to do that exercise. For men, sometimes it's a little bit easier to think of it as the muscles that control flatulence. So if you're trying to hold in a fart, that's also the right set of muscles. Hold those for 5 seconds, release them for 5 seconds. And don't skimp on the release. Relaxing those muscles is just as important in the exercise as holding them. Some other things you can do are what are called quick flicks. And now that I've just explained a Kegel, a quick flick is just kind of a variation on a Kegel. It's where you do that same maneuver where you're contracting those muscles, but you're going to do it much faster, where you go a second on, a second off, second on, second off. This actually has a little bit different effect, not as much for strengthening the muscles, it's actually for kind of tricking your bladder into thinking that it has gone, and it kind of calms down that sensation of urgency. And so that's something to do at the time when you start to feel that fullness and you're starting to be afraid, maybe I can't make it to the bathroom. Try a set of quick flicks, 10 of those, 1 second off, 1 second on, 1 second off, 1 second on, 10 of those reps, and see if that gives you just a little bit more time to make it. But honestly, sometimes doing these kinds of exercises on your own can be hard. It's very difficult for us to isolate that set of muscles. It's a set of muscles that's supposed to just work on its own and that we're not supposed to have to think very much about. And so if you're having trouble really understanding what you're supposed to be doing, and that can be a lot of people, it's not a bad thing to ask for some help. And so we actually have a set of very specialized physical therapists who really just work with women and men on pelvic floor muscle control and rehabilitation. And they can be incredibly useful at helping you get through some of these issues and learn how to use your muscles to help your bladder work better. And so they may use something like biofeedback, which is what you're kind of seeing here, where they may employ actually a computer to help train those muscles, or they may just work with you, talking with you, working through exercises. It's often very individualized, but it can be incredibly helpful. And again, very little risk to doing that. All you got to do is make the time to do it. Some other things, and this is really central, a lot of these issues can be resolved with just managing your fluids a little bit smarter. And some of those things can be just reducing your overall fluids. A lot of people really believe that they need 8, 10, 12 glasses of water a day to be healthy, and that's really a myth. Now, there are some medical conditions where maybe it is necessary to make sure you maintain a really good state of hydration, but for most people, you actually don't need that much water. You just need to drink when you're thirsty. And we get a lot of water just from our regular food and other things that we take in over the course of the day. So you can really just listen to your body and cut back on the fluids to what you feel the need to drink. And the other things that you can do are to change when during the day that you drink your fluids. And so let's say maybe you don't feel good unless you're having 6 to 8 glasses of water a day, but when you do that, you're getting up 3 times at night. Well, one other trick is to take those 6, 8 glasses of water a day and just move them much earlier in the course of the day so that you're drinking the most of this before noon and a little bit less in the afternoon, and really stopping drinking probably around dinner time, a couple of hours before you go to bed, so that by the time you get to bedtime, your body's had a chance to really process most of that fluid, and you're gonna have to get up a lot less at night. And then another thing you can do is do that same kind of thing, but do it in anticipation of times when you're gonna leave the house. So if you know you're gonna be on a long car drive in the afternoon, that may be a time when you also wanna sort of take a step back and limit your fluids in preparation for that. Now, obviously that isn't enough for everybody, but often it can help, particularly in situations that you might be avoiding because you're worried about those urges. Lastly, one of the biggest things that actually can make a big difference is weight loss and exercise. And the exercise alone, just to be clear, can sometimes be enough. And weight loss that's only a very small amount of what you would think your overall goals should be, can again make a big difference in how your bladder functions. So let's say you're 50 pounds over where you'd like to be in terms of weight, but you're thinking to yourself, gosh, that's a lot. That's a really hard thing to think about as a goal just to make my bladder better. Well, that doesn't have to be how it works. Most of the time, a little bit of weight loss, especially when combined with exercise, can by itself be enough to get you much better bladder control. So again, you don't have to think that you're going to have to look like a model to make your bladder feel better. Just a little bit goes a long way. And then general good health advice. Smoking is a terrible irritant for your bladder. It's also just terrible for you in a lot of other ways. But especially if bladder control is a big issue for you, quitting smoking can be great. It helps the blood vessels to your bladder function better. It takes a lot of irritants to your bladder out of the way and just generally is much better for your health. So if you need one more reason to quit smoking, consider this that one more reason. All right, so you've tried all those things. And it's just not cutting it for you. You're still limited. You still are getting into problems, getting into situations where you're having accidents, and it's just messing with your life and messing with your self-esteem. Well, definitely time to talk to your doctor, because there's a lot more things we can do other than what we just talked about. And so the next step, if you've tried all that stuff, or even if you need to do this in combination with some of that stuff, is that there are many different medications, and they come in a bunch of different forms. In general, the overall goal for a lot of these is to make your bladder hold more, to reduce those spasms that cause that urgency and leakage, and basically to just give you better control over your bladder. There are two general categories of medications, what we call antimuscarinics, and then the sympathomimetics. They are different agents, so they work in different ways. They both have the same general impact, but again, they can actually be combined because they work in different ways. If one alone is not enough, you actually can combine with another one from the other class, and often that can do even more for you. Now, these come in a bunch of different forms. We have both pills, probably the most commonly used thing, but there are also gels as well as patches. And the gels and the patches often have a little bit fewer side effects than some of the pills. Now, what are those side effects? We'll talk a little bit about that. So again, the medications, they relax the bladder muscle, they allow you to hold more, they block those bladder spasms so you don't get that urge and you don't have that fear of leakage. And by increasing the amount of urine that your bladder can hold, usually they'll decrease the number of times you have to go, so that frequency, as well as the times you have to get up at night. But and of all of those different kinds of medications, there's no real evidence that any one is better than another. Now, some people do respond better to certain medications than other medications. So that doesn't mean that one is always going to be the right choice for every single person. But there's no great reason to start with one over another. Once you start taking one of these medications, your doctor's going to want to know, does it help you? That's obviously the biggest thing that is important about these medications. They're not being given to you to solve some medical problem that, if it goes unaddressed, is going to be life-threatening. This is designed to make you better. So if you're not better, it's not doing it for you. It's not the right choice for you. But the other thing to talk about is the side effects. And people do have some side effects from some of these medications, particularly the antimuscarinic class. And most commonly, those side effects are things like dry mouth, or constipation, or sometimes dry eyes or changes in vision. And if you're having any of those, definitely talk to your doctor about them. What they can sometimes do is come back on the dose or combine them or switch to a different medication class. So don't give up just because that first one didn't work for you or because it was having some side effects. And just as a side note, often the medications take a little time to work. So it's going to be 2, 3, 4 or more weeks before you start to notice. So don't give up right away. Give it a little bit of a chance and see what you can get out of it before we decide to move on to other options. What are those other options? Well, there is a third line of options, and these are actually more procedural based. And so if medications haven't done enough, or if we need to combine those medications with something else to really get you a better response, we can combine those with a couple of options for procedures. The first of which is actually bladder Botox. So same medication that people use for cosmetic relief in their face for fixing their wrinkles, but also has a number of other medical indications for a bunch of different conditions. We can use this in the bladder. And what that does is it actually physically blocks those bladder spasms to relax the bladder, allow it to hold more, prevent those issues with urgency and leakage, let you sleep a little bit longer, let you go a little less frequently. And bladder Botox is actually great. It can be done just in the office. We can do this with just some numbing medicine that we put into the bladder itself, so you don't need to be put to sleep. You don't have to get a ride. You can drive yourself there, drive yourself home, go back to work right afterwards. And this little procedure, what we do is we take a little camera that we insert through the urethra, and there's a flexible needle, which looks terrifyingly large on this picture. It's really not anywhere near that big. But that little flexible needle can be used to just inject a small amount of Botox into a couple different spots in the bladder. That, over some time, will allow the bladder to relax better and hopefully get rid of a lot of those symptoms that you're having. The downside to this is that it only lasts about 6 months at a time, so the effect does wear off. And so if this is a procedure that works for you and that keeps your symptoms controlled, most people will have to have it repeated about 2 times per year. So every 6 months or so, you come in, you do this little procedure in the office, you go back to work that day, or you go back to whatever you were doing, and then hopefully that will control your symptoms until the next injection many months later. There's another set of therapies that we sort of lump together as what are called neurostimulatory therapies or neuromodulatory therapies. And what that basically just means is that they're aimed at sort of modulating that reflex nerve cycle that we talked about earlier. And so they're going to try to prevent the abnormal nerve signals coming from the bladder that are triggering these urges. And there are 2 forms that we currently have for how we can do that neuromodulation. One is called posterior tibial nerve stimulation, or PTNS for short. And what this basically is almost like a form of electroacupuncture. We take a very tiny little acupuncture needle, which most people barely feel as we put it in, and we put it in the ankle. And where it sits, we put a little current through it, and it stimulates this nerve sort of behind the sort of ankle bone in the leg that goes back to the spinal cord at the same level where all those bladder nerves are. And that stimulation is thought to sort of calm down some of the abnormal signals coming from the bladder that trigger that spasm or that urge. And all of that's very exciting. What you feel during the therapy is actually just a little tingle in the foot, maybe in the arch of the foot or in the toes, something like that, but just a mild, comfortable tingle. Therapy is delivered in 30-minute sessions on a weekly basis. Now, to really get a good response out of this, most of the time you have to get 7, 8, 9 sessions under your belt before you're noticing a change. So you got to be able to make it to weekly visits for at least that long to figure out if it's going to work for you. And we usually start off with 12 weeks of therapy, so once a week, 30 minutes over 12 weeks. And then after that, we do little booster sessions, maybe every 4 to 6 weeks to help keep those symptoms under control. The great bit about this therapy, it's very easy, it's painless, it has very few risks, and it's really a pretty, it's 30 minutes to comfortably sit and read a book or play a game on your phone or something like that, and has hopefully about 2/3 of people will get a good bit of response out of this, get a good bit better with it. So for very little risk, you've got a chance at a good improvement in your symptoms. The downside for many people is the time that it takes to do this therapy. So there's another option, which is a little bit more invasive, but much longer lasting and frankly probably more effective in the long term. And this is neuromodulation done in a much more direct way through what we would basically call a bladder pacemaker. So there is the same kind of concept. We're stimulating those nerves coming from the bladder to block some of the abnormal signals that are coming, and that gives you better control with your brain over what's going on in the bladder. They're remarkably effective at taking care of a lot of the symptoms of the urgency and incontinence, and amazingly, they also can help you even urinate a little bit better. And their best sort of side effect or overlapping effect is that they also can very much improve bowel control. So if you are having any fecal urgency, like having to run to the bathroom to have a bowel movement, or loss of feces or flatus, meaning gas, when you get that urge to go, this can help control that as well. And so it's a great option for people, especially if they have both of those symptoms. The downside to it is that it's like a regular pacemaker for your heart. It's an implanted device. And that means that you will have to have a small procedure to put it in. Now that procedure is just a minor thing. It's a very fast outpatient procedure and can be done with like a little bit of sedation, like a colonoscopy. You don't need general anesthesia or a tube down your throat, but it does have to be put in an operating room. And once there though, the great benefit to this therapy is not only its effectiveness or its overlap with bowel symptoms, but also its longevity. So most of these devices will last up to 15 or 20 years without you having to really do much of anything. They're a long-lasting battery. They don't need recharging. They just work in the background for all that time. And most of the time, once we kind of get the whole device set up so that it's working for you, you put the remote control down, and you can hopefully forget about it, and it just does its thing while you hopefully go about living your life. So that's another great option for people. There are some more things that are possible. I'm not going to go into a great amount of detail for those because what I've talked about already are really our mainline treatments. And everything beyond that is really for very severe patients who have not had any luck with the therapies we've tried, or for people who are interested in something a little bit more cutting edge, meaning something more experimental. And there are those things. There are things that are being tried all the time, new medications, new procedures, new devices, and a lot of those trials are going on here at UCLA, and you can find about those on our website. But those are probably things that will be a discussion one-on-one with your physician if it becomes time to think about those. And lastly, we mentioned, are there options for OAB that are only surgery? Well, there are some surgeries that we can do, some bigger surgeries than the ones that I discussed, but those are things like making the bladder physically bigger so it can hold more. And those we really rarely do anymore and reserve those only for the most severe of cases. So, what is in the future? I teased a little bit that we have some clinical trials ongoing, and so all the time there are new medications on the horizon, and we hope to see some of those coming down the pipeline very soon. We've got new treatments for the bladder itself. There are alternate forms of Botox that may possibly be possible in the future. A lot of these things are being tested as we move forward. There are new types of neuromodulation. We're seeing clinical trials for different types of implanted devices, not the ones that go in the lower back like the one I showed you, but new ones that go into the ankle or other places. And then we're also seeing new forms of home-based therapies like pelvic floor training that you can do at home, or pelvic floor stimulation that you can do at home. And a lot of these are currently in the process of being tested. And again, you can check out our clinical trials at the UCLA Center for Women's Pelvic Health on our website. So I will finish up there by just saying that there are a lot of resources that you can access. I've listed a couple of places that you can go for more information if you're interested in learning a little bit more. The Urology Care Foundation is a great source of additional information. The Society for Urodynamics, Female Pelvic Medicine, and Urogenital Reconstruction also has some learning modules, and you can find there this little pathway or patient roadmap on how to take care of your bladder, Guide to Better Bladder Control, and it goes through step by step some of those things that we've talked about. And then here are some other resources, the International Urogynecology Association and the European Association of Urology. Thank you so much for spending this time with me and for learning a little bit more about overactive bladder with me. Please feel free to join us on our website for additional information, and we look forward to helping you. If there's anything you need, give us a call.